Hello and welcome to another episode in our podcast series from Department of Neuropathology at Heidelberg University Hospital. I'm your host, Zara Heather, and in this series we discuss recently published studies with their lead authors, and we especially highlight their translational and clinical impact. So joining me today are leading authors of a recent comprehensive study describing a genetic subtype of oligodendrogliomas of younger patients. So we have with us Dr. Luca Bertero, who is an associate professor and consultant pathologist from the University of Turin. Hi.
Hi, hello.
And then we have Dr. Filippo Nuzzoli from the University Hospital Florence, and he's a consultant pathologist there. So thank you both for being here.
Thank you for the invitation.
So I'm going to jump right in. Could you start by describing oligodendrogliomas as a clinical entity and about the typical genetic and epigenetic hallmarks that basically define these tumors?
Yes, oligodendrogliomas are diffuse gliomas arising typically in young adult patients with a peak of incidence in the fourth and fifth decades. And the entity defining molecular alterations include IDH mutations, and we observe in oligodendrogliomas a higher rate of IDH2 gene mutations compared to astrocytomas. And the other entity defining molecular alteration is the 1p and 19q codeletion. So recently, other additional and not entity-defining alterations were demonstrated, such as CIC mutations occurring in almost the 70% of this tumor, and then also FUB-P1 mutations. So TERT promoter mutations is also known as universally present in oligodendrogliomas, and therefore we aimed at exploring the minority of these cases with lacking TERT promoter mutations. From the epigenetic point of view, oligodendrogliomas differ from astrocytoma IDH mutant astrocytomas, also for the different clustering as demonstrated by the t-SNE plots. So they differ from astrocytomas in both genetic and epigenetic features.
Yeah, maybe I think that could also add is a bit about the clinical context, because as Filippo mentioned, this is a tumor typical of adult patients, young adults, middle-aged adults, and so usually there are people who are very active. They work, family, maybe children, and so they can be quite symptomatic, for example, in terms of seizures. So it's a tumor which has a significant impact over the quality of life of patients, and also in terms of survival, because so far, despite having a better outcome compared, for example, with IDH mutant astrocytomas, anyway, usually oligodendrogliomas are considered a tumor with a very strong recurrent potential. So usually the patient undergo multiple recurrences, and usually the tumor transforms from a lower grade 2 tumor to a grade 3. So it's a significant clinical issue for patients.
So I see. So a key focus of your study was the status of TERT promoter mutations, and what you show here is that it is the mutation status that stratify patients into this new subgroup. What was the impact of the wild-type TERT promoter mutation status on the DNA methylation-based clustering of these patients with oligodendrogliomas?
in terms of epigenetic profile, TERT promoter wild-type oligodendrogliomas closely resembled their mutant counterparts, but shaped a distinct cluster at the almost periphery of TERT-P mutant oligodendrogliomas. We observed that while IDH mutant and 1p19q correlated oligodendroglioma achieved the highest score in Heidelberg's brain tumor classifier, the vast majority of TERT wild-type cases had scores below the cutoff of 0.9, indicating a slightly different epigenetic profile, which was confirmed by the TSNE analysis we performed.
So, one particularly intriguing hypothesis you explored was whether, in the absence of gain-of-function TERT promoter mutations, maybe TERT overexpression might be regulated epigenetically. So, how did you look at this, and what did your results show?
It's this is a very important issue because the function of TERT promoter, it's critical for a tumor cell to avoid replicative senescence. So if a tumor cell has to proliferate potentially unlimited with limited proliferations, it has somehow to acquire this kind of molecular alteration. No? Our first hypothesis was that, for example, there could be a different type of alteration, which could be a surrogate of TERT promoter mutation. No? And this was we performed this analysis in the first part of the study. So we did extensive sequencing to check if, for example, we found alterations which are more common of different brain tumor types. And we did not observe this kind of alterations. Then, as you mentioned, we also explored the possibility that there was some different kind of regulation of TERT promoter, but in the end we did not find something supporting the different mechanism for which there was an activation of TERT promoter or TERT function. No? And this is also important for, as we will discuss later, about the clinical implication, because since this subgroup has strong clinical implications, it was also important to try to understand and to confirm that there was a biological difference, between TERT mutant, TERT promoter mutant, and TERT promoter wild-type tumors, and this is what we have observed, that there seems to be a true difference in the activation of TERT promoter TERT function, which seems to be missing in our subtype of tumors.
Okay, so let's talk about the patient outcome and the prognostic impact of the wild-type TERT promoter status. What did you find about the clinical course of these patients that have the wild-type TERT promoter status compared to those cases that have mutations in the TERT promoter?
Yes, as you said, the prognostic significance of our findings represent maybe the key finding of our study. So that the key finding of our study is the prognostic impact of TERT promoter status in oligodendroglioma patients, because TERT promoter wild-type patients showed a significantly better outcome in terms of progression-free survival in both Kaplan-Meier and multivariate regression analysis, stratified by age, by CNS WHO grade, and by extent of resection. Our findings expanded the concept of molecular grading in adult-type diffuse gliomas, in particular in oligodendrogliomas. And I think that in this point lies the novel approach of this study, because we were focused on identifying biomarker of more favorable clinical course. As in many recent papers, the focus was on identifying molecular markers of more aggressive behavior, so that we can imagine that TERT promoter wild-type oligodendrogliomas represent an extreme pole of benign clinical course compared to, for example, studies focused on CDKN2A deletion in oligodendrogliomas, representing the malignant counterpart of oligodendrogliomas. Also, I think it's interesting to note that based on our findings, TERT wild-type cases undergoing subtotal surgical resection showed a better prognosis compared to TERT promoter mutant cases with surgical gross total resection.
This is particularly interesting that you actually highlight and emphasize the prognostic impact of this new subgroup. And in this paper, you describe this as a peculiar subtype of IDH mutant oligodendrogliomas. So if you would like to propose this as an important classification in the WHO classification protocols, for example, how would you summarize these subgroups genetically, clinically, and with the prognostic characteristics?
Yeah, I think that could be an important step to translate this data into the routine diagnostics. And probably there are two main points. The first one is that concerning most of the molecular profile of these tumors, they seem really to belong to the canonical oligodendroglioma IDH mutant 1p19q codelated. So the tumor family, it's the same. The next step is how to use the TERT-P status, and probably based on our data, the data we have so far, it seems to be a good potential grading criterion. Like Filippo mentioned previously, now we are continually to move towards molecular grading and not just integrated molecular diagnosis. And as we have done for many tumors, and now we use CDKN2A status as a grading parameter. We could also hypothesize to use TERT-P status in oligodendroglioma to identify a specific grade of these tumors, a lower grade, and as we a bit provocatively in the title of our manuscript, we propose a potential grade 1, because we have very, very long survival without recurrence. So this is a potential. Also, from a practical point of view, it's also useful that it's commonly available marker which can be tested now in many centers, because it's already used, for example, in meningiomas. So it's something which can be used, and it could be really important if we want to stratify the outcome of these patients, which can be very variable.
And I think also we found a strong correlation between TERT promoter wild type status and age, because this is important because also for testing, based on these findings, testing for TERT promoter in oligodendrogliomas could be appropriate, in particular in adolescent and young adult patients, because more than the 90% of wild-type cases were found in patients aged between 14 and 21 years old.
So this actually naturally brings us to the final theme of this talk, and that is, as Luca, you already mentioned, the implications of using this marker for further stratification of patients at diagnosis. So I would like to ask, what does this mean for the patients themselves and also for the clinicians? Like, do your findings have clinical implications, particularly in guiding treatment, for example, or in stratifying patients, as we mentioned before, based on risk at the time of diagnosis? So basically, the question is, how do you envision the clinical implementation of your results?
Yes, we basically spend towards the prognostic aspect, but I think it can be relevant also for the treatment strategies, because our findings hold clinical relevance also in light of the recent approval by the FDA of the vorasidenib, an IDH inhibitor that was approved for the treatment of low-grade gliomas, low-grade IDH mutant gliomas, and some studies have identified a sort of gray zone in patient selection for treatment. So I think that in this intermediate risk subgroup of patients, the TERT promoter status can provide a more objective criteria to select patients for treatment or not.
Yeah, I also think that this is important because since these kind of treatments, vorasidenib is a very good treatment in terms also of adverse effects, which is a therapy which seems to be very good tolerated by the patients. No, so it's a potential treatment which could be administered without significant issues, but otherwise it's also a treatment which is usually with the data we have until now, use it for extended amount of time, because you use it until progression. So it's something which anyways has a cost also for the patient to do a chronic treatment. So if we are able to identify potential markers for using more appropriately this kind of treatments is also important. And I think it's also important to consider that in the past, the guidelines have, but also now, have always considered age as a prognostic marker for diffuse gliomas, IDH mutant diffuse gliomas. And so our study helps to give a more objective parameter to explain why younger patients can show a superior outcome. Obviously, probably it's not just TERT, obviously, since it's TERT wild-type cases are rare, but can help to understand these differences.
As Luca said, it can be used to maybe identify the best candidates for watch and wait versus vorasidenib treatment.
This has been a very deep dive into how refining the diagnostic classification of tumors like oligodendrogliomas can help shape and basically pave the road for a more personalized care for patients. And I think your study has actually shown how this could be put into action, especially by mentioning these recent drugs approved by FDA that have low morbidity or side effects that is important for this particular patient group, where the age is, these are young adults that we're talking about. So Dr. Luca, Dr. Filippo, thank you so much for joining us, and thank you for taking us through this study that you've recently published.
Yeah, thank you for hosting this podcast. Yep.
It was a pleasure for us.